see the screen?
Yeah.
Okay. All right. So, hi, I'm Ploypun. Today I will present the research entitled "See Diabetes at Patient-Centered Diabetes Self-Management Education and Support for Older Adults: Findings and Information Needs from Patients' Perspectives." So this is our research team. I'm a PhD student working with the Dr. Kim lab. Also, we have Dr. Khan, Dr. Berlin, Dr. Day, and Dr. Simos as our researchers. Okay. Diabetes Self-Management Education and Support, DSMES. DSMES also should be individual, considering clinical variables, functional variables, and personal preference. The SMEs for older adults should weigh potential benefits and risks and involve multiple disciplines and caretakers. The SMEs should be delivered at diagnosis annually or when not meeting treatment targets, when complicating factors develop, and when transition in life and care occur. Aim of the SMES is to help people with diabetes and healthcare providers navigate daily self-care, improve clinical outcomes, and prevent or delay its complications. ADCS7, self-care behavior. ADCS7 is a robust framework launched by the Association of Diabetes Care and Education Specialists to deliver the SMES. The SMES7 provides a practical model that informs decision-making among individuals living with diabetes and related conditions, and the members of their healthcare team in their shared drive for improved health and quality of life. Healthy coping must begin before learning can occur. This behavior is centrally located at the core of the updated image that represents the ADCES7 to symbolize its significance in sustainable diabetes self-management. There are 7 principles of ADCES7. The first one is healthy coping. Healthy coping provides different ways for people with diabetes to deal with emotional problems such as stress, depression, and anxiety related to diabetes. Healthy eating help people with diabetes to eat regular meals, control the amount of food, and choose healthy food. The third one is being active. Being active helps people with diabetes to lower cholesterol, improve blood pressure, and lower stress and anxiety. Number 4 is taking medication. Taking medication helps keep people with diabetes blood sugar stable and decreases the risk of complication. Monitoring helps people with diabetes to track and confirm whether blood sugar levels are within target goals. Reducing risks help people with diabetes to reduce the risk of stroke, lost vision, and nerve damage by encouraging patients to quit smoking, have regular clinic visits, and take care of their feet. The last one is problem solving. Problem solving helps people with diabetes to prepare in advance for unexpected situations such as hypoglycemia and getting ill. Open Notes. In 2010, the Open Notes project started to investigate the effects of sharing notes between physicians and patients. The Open Notes project involved more than 100 primary physicians and approximately 25,000 patients to review their physicians on note online. Most patients agree that sharing clinic notes would be an important factor for seeking a future physicians and health plan. Then 7 years later, the follow-up study indicated that older people are potentially the most vulnerable and receive the most benefits. The benefits in this study included taking care of health, active role in care, feeling in control of care, making the most of visits and remembering the plan of care and preparing for the visit. So why we conducted this study? The role of patient-centered DSMES in clinic notes to improve diabetes have not been evaluated. According to our previous study, there was a lack of patient-centered education in clinic note. To help providers deliver the SMES and ADCES7 self-care behaviors, we developed an educational aid named C Diabetes from Support, Engage, Empower Diabetes. C Diabetes was developed based on user-centered design. C Diabetes will support patients and providers in shared decision-making by organizing knowledge and information of ADCS7 principles presented at the appropriate times to promote better health. The ultimate goal is to implement the C Diabetes in the clinic notes and provide patient-centered education for older people with diabetes, following the SMES and ADCS7 guidelines. What is user-centered design? User-centered design is an interactive design project in which designers focus on the user and their needs in each phase of design process. User-centered design have 4 phases. Understand the context of use, specify user requirements, design solutions, and the last one is evaluation against requirements. This study is the second step of user-centered design, which is user need analysis or user requirements. This is an example how to use C Diabetes. We create 7 sets of the auto text for C Diabetes, which is provider can choose from. And then when providers choose, for example, being active, it will provide the auto text about being active in like at least 3 simple sentences written in 6 grade level. And then it can be adjustable depending on individual patient. And after that, the clinic note will display patient education item under the assessment plan section. And this item will be more specific on patient needs. The strength of, there are 7 strengths of C Diabetes. The first one is C Diabetes provides tailored the SMES option based on shared decision making. Second, C Diabetes will be aligned with the provider workflow. Third, C Diabetes will be written in secret reading level to be clear and succinct language for people with diabetes age 65 and older. Last, the C Diabetes will guide a healthcare teams to provide an effective patient-centered cooperation and goal setting to improve health outcome and quality of life. So the objective of this present study is to determine the C Diabetes information needs of people with diabetes age 65 and older. This research is mixed method study. So first, we started with the survey. We would like to determine the preference of patient portal usage and the reading clinic note among people with diabetes, and to compare the differences between the younger group and the older group. In the survey, we collected participant characteristics and asked these 3 questions. Do you access your medical chart using the patient portal? If yes, how do you access your medical chart and why? The last one is, have you ever read a clinic note in your chart? For focus groups, we would like to explore patients' experience of reading clinic notes, focusing on older adults and to accumulate opinions that would help to improve the C Diabetes. We demonstrate 3 randomly selected de-identified clinic notes of patients with diabetes. Then we ask this question: is the clinic note easy to read? Why or why not? Is this note helpful for patients with diabetes? Who do you think you should discuss the DSMES principle with you? When would be the best time to discuss the DSMES principle? And the last one is how to improve C diabetes. For the first two questions, we asked after participants review each clinic note. Data collection and analysis. First, people with diabetes in all age groups were invited from specialty care at Cosmopolitan International Diabetes and Endocrinology Center and primary care at multiple locations of family medicine clinics. Then participants who accepted to join the research received a link to an online survey via email. Survey data were collected and managed using LEDCap. Second, we included people with diabetes age 65 and older for focus groups who accepted the invitation through the survey. Third, focus groups were conducted and recorded via Zoom. Participants were asked to evaluate three randomly selected de-identified clinic notes of people with diabetes. Last, descriptive analytics were performed to analyze participant characteristics and medical chart accessibility. Thematic analysis was used to analyze qualitative data from focus groups. Let's talk about the results. The results from survey, the total participant is 37 years old, 84% from diabetes specialty care. Average age was 66 years old. There were 15 males and 22 females. Almost all of them is white and non-Hispanic. No one graduated less than high school. Average diabetes duration was 21 years, and almost 80% access the medical record and have read the treat note. The result from the participant characteristic in focus group study, we have a total of 9 participants and 5 were males, 4 female. The average age was 71 years old. The average diabetes duration was 30 years. 8 participants were up with specialists and 1 follow-up with a primary care physician. So for the focus groups, the picture on the left is clinic notes that we use in focus groups. We asked, is the clinic notes easy to read and why or why not? And is the note helpful for people with diabetes? After they review each clinic note. When we finish our section of focus group, we transcribe and of the recordings and perform thematic analysis. The first theme is legibility of a clinic note. There is the reasons that we got from the participants for the participant who said it is easy to read because the note provides concise information. It's a reminder of what had been discussed during the visit, a plan of treatment, and well written in English. It's not easy to read because Green Note had too many technical terms and abbreviations and poorly written sentences. The second theme is helpfulness of clinic notes. Participants mentioned it is helpful because it's easy to understand, it's precise notes, and it's the good format of writing and providing detailed information. It is not helpful because they provide not enough information about medication, use too many abbreviations, and not well written in English. This is an example statements that participants said during the focus group. I give an example from grade note number 2. A female 69 years old, duration of diabetes is 63 years, said it is easier for me because sometimes when you do your note, you have to look to see what I need to change and what your advice is for particular areas. Male 82 years old, duration of diabetes 27 years, said I think I get lost in there. There's too many technical terms that are I'm not familiar with. Then I thought I have a lot of notes regarding diabetes, but this one is confusing for me. Another person who agreed that this note is not easy to read is male, 76 years, diabetes duration, 52 years, said some of the coding on there is not understandable, and that's very important to know about. So if there's some way to state that in more everyday language for us, and maybe PPSV 23 UTD could be in parentheses after explanation. Another examples about helpfulness. The participant who said it's helpful is from female, 69 years old, duration of diabetes, 63 years, said, yeah, it's helpful, helpful for me. I like the format. Another person said, yes, I read it the second time. I am able to understand it better because the first time I was coming upon that and it was I just know briefly, but now I can understand the context better. It is pretty, you have to know a lot to read this and understand. So I would like it to be simpler, but I do think they are great. And the person who think this is not helpful because it's not for me, I understand it for me, not XR, there are a lot of abbreviations. For the other questions, 7 participants mentioned that they would like to discuss the SMES with providers. There are no specific time. It could be before, during, or after clinic visit. When we demonstrate C diabetes, we ask how to, when we demonstrate that C diabetes, we ask how to improve. The participants suggested that C diabetes should provide concise information, use motivational words, use guiding words, add the external resources such as support group, and add the patient education section. For conclusion, almost 80% of participants were able to access the patient portal and read the clinic notes. The older group could access the patient portal and clinic notes similar to the younger group. Participants suggested clinic notes should use fewer abbreviation or technical terms, be written in complete English sentence, provide concise information, use motivational words. And participants would like to discuss the SMES with providers. Our limitations. First, all participants were non-Hispanics and most of them were white. However, it is typical characteristics because the majority of the Midwest population are non-Hispanic and white also. Second, we conducted an online survey and focus group via Zoom, which may have led to selection bias. Participants without internet and are not familiar with technology would not want to participate in our study. However, we aim to identify the C diabetes information needs, which will be implemented in the patient portal, so our results can represent the population who have access to patient portal and medical charts via the internet. Third, our numbers of participants were less than recommended. We were not able to recruit more participants to reach our target number. However, our findings show that our study had data saturation, so we decided to discontinue recruiting more participants after the third focus group. Takeaway message. Most participants share that they read the clinic note. Clinic notes can be used to communicate not only with other providers, but also with patients. The readability of clinic notes was the main concern and related to the helpfulness of clinic notes. Future direction. This study is the second phase of user-centered design. Our users of C diabetes will be both providers and patients. So we conducted a parallel study. for providers and will be reported in a separate presentation. After we correct all information, the statements in C diabetes will be adjusted and continue working on phase 3 and phase 4. We will iteratively evaluate the readability and usability of our C diabetes prototype in the future. Thank you. You have any question?